Gentlemen, if you're over 40, especially over 50, pause for a second and take one slow breath with me. Because if you've been researching erectile dysfunction online, I already know how you feel. Confused, overwhelmed, and honestly, a little worried. I'm Dr. Greg Sean, urologist with 25 years of experience, and before we talk about pills, devices, or testosterone, let's talk about the real issue most men never hear explained properly. What's actually causing your erections to weaken, and how to fix the root of it. If you've noticed changes in firmness, stamina, or reliability, I want you to hear this clearly. You are not broken. Your body is not failing you. Most of the time, it's responding to changes in blood flow, stress, sleep, and vascular health, and those things can be improved. In this video, I'll do 3 things for you. Explain the most common causes of erectile dysfunction in plain English. Show you the core mechanism that affects most men as they age. Give you a simple plan to improve erections naturally and explain when medical treatment is appropriate. No hype. No false promises. Just real urology. 1. What erectile dysfunction actually is. Erectile dysfunction, also called ED, is the inability to get or keep an erection firm enough for sex. A single bad night doesn't mean you have ED, but if it's happening repeatedly, especially over weeks or months, it's worth taking seriously because ED is often a signal, not just a bedroom issue. 2. Why just testosterone is an oversimplification. A lot of men assume ED is simply low testosterone, but here's the truth. There are men with normal testosterone who struggle with erections, and men with low testosterone who don't. Testosterone matters, but for most men, it's not the main switch that turns an erection on. The main switch is something else. 3. The real master molecule behind erections. One of the most important molecules involved in erection strength is nitric oxide. Nitric oxide is produced by the lining inside your blood vessels, called the endothelium, and its job is simple. It helps your arteries relax and open so blood can flow in strongly. No nitric oxide, no proper vessel relaxation, and erections become weaker, slower, or inconsistent. And yes, nitric oxide tends to decline with age, which is one reason ED becomes more common after 40. This is also why medications like sildenafil, Viagra, work for many men. They support pathways related to nitric oxide signaling. But here's the part most men don't hear. If you only rely on medication without improving the underlying system, you're often just managing the symptom, not improving the foundation. 4. What lowers nitric oxide and wrecks erections? Let's talk about the main drivers I see in real patients. A. Vascular health, blood vessel health. If the endothelium is damaged, nitric oxide production drops. This is why ED is so closely linked with high blood pressure, diabetes, high cholesterol, and smoking history. B. Sleep and breathing problems. Men with poor sleep, especially sleep apnea, often have worse erections, because sleep affects nitric oxide, hormones, and nervous system balance. C. Stress, anxiety, and cortisol. Erections don't happen when your body is in fight or flight. They happen when you're calm, parasympathetic, not sympathetic. So if you're stressed, anxious, sleeping poorly, your body is literally not in erection mode. D. Lifestyle factors. Excess alcohol, high sugar intake, inactivity, being overweight, these all push nitric oxide down and inflammation up. And the result is predictable. Blood flow weakens, firmness drops, confidence drops, performance anxiety rises, ED worsens. That loop is brutal, but it can be reversed. 5. The simple root cause improvement plan, no gimmicks. Now, if you want to improve erections naturally, you're not looking for magic. You're looking for the highest leverage habits that increase nitric oxide and support blood flow. Here are 5 that are realistic and effective. 1. Start nasal breathing, especially during light activity. Breathing through your nose can help support nitric oxide levels and improves oxygen delivery. 2. Regular exercise. You don't need extreme workouts. Consistent movement improves endothelial function, meaning better nitric oxide production over time. 3. Eat nitrate-rich foods. Beets, spinach, kale, arugula, leafy greens. These support the nitric oxide pathway. 4. Reduce the biggest nitric oxide killers. High sugar intake, excess alcohol, smoking. These damage the endothelium. 5. Improve sleep quality. If you suspect sleep apnea, snoring, waking tired, daytime sleepiness, talk to a doctor. Fixing sleep can change erections dramatically. 6. When you should see a doctor, important. I want to be very honest here. If ED is persistent, you should not guess your way through it, because ED can be an early warning sign of cardiovascular issues. In a proper evaluation, your doctor may look at blood pressure, diabetes screening, cholesterol, testosterone, when appropriate, medication review, some antidepressants, blood pressure meds, etc., mental health factors, and sometimes further tests depending on your situation. This isn't to scare you, it's to protect you and get you real answers. 7. Treatment options. Clear, non-salesy. Treatment depends on the cause. If stress, anxiety is a major factor, psychosexual therapy and nervous system regulation can help. If lifestyle is driving it, weight loss, exercise, sleep, alcohol reduction can be enough for many men. Medications like sildenafil can be very effective, but avoid buying online because counterfeit products are common. Vacuum devices can work for some men. Implants exist, but are usually reserved for men who have tried everything else. The key message is this: most men can improve ED, especially when they understand the mechanism and address it correctly. If this video already feels different from what you've been hearing online, it's because I'm not here to hype you up. I'm here to guide you, clearly, calmly, and honestly, like I do in my clinic. This channel is Dr. Greg Sean, and I've spent 25 years helping men regain confidence and control without shame. If you want more science-backed videos on erections, prostate health, testosterone, and performance after 40, subscribe and hit the notification bell. And if you're comfortable, leave a comment with just 2 things: your age, and whether you want the next video to focus on blood flow, testosterone, or performance anxiety. You're not alone in this. Most men just suffer silently. And remember, your body isn't broken, it's adaptable, and with the right steps, it can improve.